Breast Ironing in Cameroonian Women by Ravonda Lewis, Tamika McGee, J.M. Mack, and Lily Nyong'o. Overview of Cameroon and Cameroonians. Cameroon has a population of approximately over 24 million individuals. 60% of the population is under the age of 25. Cameroonians are a mixture of indigenous cultures which include the Bantu, Kurds, Highlanders, and other groups. This is a group that is from Western Africa, and most immigrants that come to the United States come from Western Africa, although the numbers from Eastern and Middle Africa are growing. Of the 1.6 million foreign born from Africa in the United States, 36% are from West Africa. Per the U.S. Census in 2015, there are approximately 51,172 from Cameroon in the United States. Overview of Cameroonian origin. Cameroon is a country in Western Africa. Religious identities in Cameroon vary from Islamic, Christianity, and other religions. 40% identify as Christian, 40% follow from indigenous religions, and 20% follow Islam. Cameroonians speak French, English, and other indigenous languages. The political system in place in Cameroon is a presidential republic. Cameroonian views on health and illness. Cameroonians believe that good health is the result of appropriate behavior, which is living in accordance with the values and norms of their society. Good health is also viewed as having good relations with ancestors, the community, as well as being a collective member in one's own community. Illness is perceived as being caused by attacks from evil or bad spirits, or if ancestors have not been treated well, they may punish those with an illness. Spellcasting and witchcraft are also plausible reasons for an illness, and those with evil powers can cause their enemies to become sick as a form of punishment. Cameroonian health maintenance and beliefs. Tribal groups in Cameroon use traditional practitioners such as herbalists, diviners, and ritual specialists to both prevent and protect health. Diviners use bones and the spirits of the ancestors to diagnose and prescribe medication for the different physiological, psychiatric, and spiritual conditions. Physical health is attributed to the relation an individual has with their ancestor. Spiritual health is attributed to ancestors or the benevolent spirits that protect their people against evil and destructive forces. Mental health is viewed as a spiritual curse on the family or individual. Time, space, social organization, and biological variations. Cameroonians' sense of time is past-oriented. Their space is based on tribal and religious influences. An arm's length is considered appropriate, and personal space tends to be less between members of the same gender, good friends, and family. It is also common between good friends of the same sex and or family members to touch the hands, legs, and shoulders during conversations. The Fulani Grassfielders, Biamiki, and Bamoun are the groups that build the social structure in Cameroon. Social organizations can follow the hierarchical status of royalty, nobility, commoners, and slaves, or the egalitarian structure which relies on the age and gender of the individuals. Gender roles in Cameroonian culture and environment. Men have a higher status than women in regards to issues such as marriage, divorce, land, social, and government organizations. Women usually are taking care of the households, and the men should usually take care of the outside. The women raise the children and feed the family. There is a combination of traditional medicine, Islamic medicine, along with biomedical treatment. The government, in combination with World Health Organization, has begun a platform to pursue advancements in traditional medicine. Social factors affecting Cameroon. Corruption, unemployment, and illiteracy are the main examples hindering the Cameroonians from accessing healthcare. Corruption in the public health system due to poor leadership and mismanagement has left many Cameroonians without access to basic healthcare. People are forced to pay bribes to medical providers to obtain free health services to which they are entitled to. Cameroon has an unemployment rate between 40 to 50%, with about 50 to 55% of the total population living below poverty line. Most Cameroonians live on less than $1.25 a day. Poor education remains a big problem in Cameroon, with the literacy rate at about 68%. Environmental factors infecting Cameroon. Malaria, a mosquito-borne infectious disease affecting humans and animals, is a disease that has claimed many lives in Cameroon. Transmission of malaria is heavily influenced by climate and environment. Poor housing conditions in the surrounding environment in Cameroon favors mosquito breeding, such as bushes, garbage heaps, swamps, stagnant water surrounding many houses in the village. Other environmental factors include the volcanic activities from Lake Nyos and Lake Monoun that produce poisonous gas, which remains an ecological concern. Poor sanitation is also a major concern due to the unavailability of clean drinking water and water for domestic use. Breast ironing in Cameroon. Breast ironing is a practice of flattening young girls' breasts as young as 8 years old by pounding and massaging them with hot objects to make them disappear. Many mothers practice this tradition with the defense that breast ironing protects the girls from sexual violence such as rape and prevents early pregnancy and also allows girls to be educated rather than get married early. Health-related issues from the practice of breast ironing include tissue damage resulting from the burns and deformities of the breast tissue, pain associated with the process, fever, abscess in the breast, severe chest pain, breast infection, malformed breast, and an increase in the number of cases of diagnosed breast cancer were identified in women who underwent breast ironing. Context and assumptions: health, HIV and AIDS, and malaria. Religion. Freedom of religion is protected by the Cameroon Constitution. Mostly Christianity and Islam are practiced. Cultural views: home of 230 languages, extended family is the focus of the social system. Men shake each other's hands. Elders are greeted first. Women do not look each other in the eyes. Healthcare delivery. Most would think that health delivery is only given to those that are wealthy, but in Cameroon, healthcare is provided to all and given out to all as they continue to improve. Missteps U.S. health providers may have with Cameroonians. If one from Cameroon was to come into an office in the U.S. seeking health assistance, a healthcare provider may take missteps when it comes to assumptions of women speaking for themselves. As men are traditionally the head of the household, it is more common for them to speak while the women hold their head down as a sign of respect. They may also misstep their affordability for the cost of the care. A health provider may mistake that a Cameroonian may want prescribed medicine, but they are known to traditionally handle their illnesses. Trade material goods, capital goods, and industrial supplies and equipment. Quality healthcare, HIV and AIDS is known but not as severe, and there is a class system in the United States. In Cameroon, good agriculture and wealth of natural resources, poor water and sanitation, HIV and AIDS and malaria is a widespread disease, severe shortage of medical professions, poverty is widespread, and oil and agriculture exports. These are our references.